In the practice of traditional Chinese medicine, the eyes are not just for vision, they are direct, physical extensions of your deepest internal organ networks. By observing specific structures within the eye, a practitioner can track the movement and quality of Shen, blood, Jing, and Qi across the body. We are going to walk through a systematic observation method. In under 60 seconds, you can identify these 4 distinct markers and apply their diagnostic meaning. Mastering this visual shortcut provides a non-invasive, objective baseline of systemic health. You gather this data before the patient even begins to describe their symptoms. This map links eye zones to organ systems. The pupil corresponds to kidneys and Jing, while the iris connects to liver blood. The sclera reflects lungs, the canthus ties to the heart, and eyelids correspond to the spleen. Step 1 of the assessment begins before you analyze any of those physical structures. You must first observe the patient's Shen, or spirit. A healthy Shen on the left is bright and focused. On the right, a disturbed Shen is dull and lifeless, indicating Qi and blood deficiency. You can also spot active disturbances. A restless, darting gaze points to heart fire, while a vacant stare reveals a deep depletion of Jing. Shen dictates the fundamental vitality of your patient. Without assessing the spirit, purely structural observations lack the context needed to make an accurate prognosis. Step 2 is reading color changes. Red eyes signal liver or heart fire, while a yellow sclera indicates damp heat. Pale eyes reveal blood or Qi deficiency, and a dark tone points to blood stasis or kidney deficiency. Step 3 moves past surface color and examines the physical tissue and form of the eye to understand the mechanism of a disease. Eyelid structure points to internal conditions. Puffy eyelids reveal spleen Qi deficiency, while drooping indicates sinking Qi. For eye moisture, dry eyes signify liver or kidney yin deficiency, whereas excess tearing points to wind or spleen issues. While eye color reflects the type of pathogen currently active, these structural changes provide evidence of how the body has been responding over time. Step 4 requires you to speak with your patient. You use their functional visual symptoms to verify the physical observations you just made. Specific visual impairments correspond to internal organ function. Blurred vision and night blindness track to liver blood or kidney deficiencies. Sensory complaints align here too. Photophobia links to liver yin deficiency, while eye pain points to active liver fire or wind. Remember the critical clinical rule. Do not attempt to diagnose a patient based entirely on their eyes. As this diagram emphasizes, you must integrate these eye findings with traditional tongue analysis, pulse reading, and the patient's overall physical presentation. Combining this visual scan with traditional holistic checks provides a multi-layered view of the patient. By checking the state of the Shen and the structure of the eye against the pulse and tongue, you move from isolated symptoms to a cohesive diagnostic pattern.